That's right. Tonight marks 1 year since Prime Minister Narendra Modi dramatically announced a lockdown. At 4 hours' notice, the country came to a halt. The lockdown lasted for much longer than the 21 days. It was designed to contain COVID cases and strengthen the health infrastructure. Exactly a year later, India now faces a fresh upsurge of coronavirus cases. India's COVID tally today. Active cases as of now, 368,457. Cases in the last 24 hours, the highest since November in a day, 47,262. Deaths in last 24 hours, 275. So death ratio less, but cases are continuing. Let's look at the entire situation in the last 1 year that India has gone through. India has had now 1.14 crore coronavirus cases, little over that. Deaths have been 1,60,441. Recoveries, though, have been equally significant at 1.12 crores. That's the overall picture over the last year. But clearly, India is facing a fresh challenge. And it's that fresh challenge that is our top focus today, the rising COVID cases. Because on a day when India reported over 47,000 cases, the Health Ministry confirmed that a new double mutant variant of coronavirus has been identified in India. This along with 700 other variants. What are these variants, and is the spike in cases related to the so-called double mutant? Before we join our special doctors roundtable and take all your questions, let's take a look at our top story today.
This day a year ago, India locked down to keep the virus out. After handling the first wave of infections, today the country is battling a new wave. India recorded 47,262 coronavirus cases in the last 24 hours, the highest since November. Now there's a new worry. A double mutant variant of the coronavirus has been found in India.
इन 18 राज्यों में मैं आपके सामने लाना चाहूँगा 771 हमारे वेरिएंट्स पाए गए। कुल हमने जो है 10,787 सैंपल्स जीनोम सीक्वेंस किए। इसमें 736 तो हमारे यूके वेरिएंट मिले हैं, 34 हमें साउथ अफ्रीकन वेरिएंट मिले हैं और एक सैंपल ब्राजीलियन वेरिएंट के तहत पॉजिटिव पाया गया।
The new double mutant strain has been found in Nagpur and Delhi. The UK, South Africa and Brazil variants of coronavirus are also spreading far and wide in India. The government is calling these the variants of concern. They have been found in Punjab, Telangana and Delhi. Government says these variants are circulating in 70 districts. While some variants show immune escape capabilities and are more infectious, the government says there is no need to panic.
Mutations का होना एक natural process है. ये होता ही रहे। वायरस एक आरएनए का स्ट्रैंड है, जब वो रेप्लिकेट करता है उसमें गलतियां होती है, नेचर का नियम है। इससे हमें पर से घबराना नहीं है। तो म्यूटेशन से बचने का रास्ता हमारे लिए वायरस को हराने के ऊपर है।
The latest spike in cases has forced Delhi and Mumbai administrations to ban Holi celebrations. Maharashtra has now announced a lockdown in Nanded and Bid till 4th April. The good news, all above 45 years of age can get vaccinated from April 1st.
Vaccinate, vaccinate, vaccinate. That is the government's only mantra right now, as we now have variants of concern, which is the UK, Brazil and South African variants, as well as a new double mutation variant that could give us sleepless nights. But the question that we need to ask now is, will these variants be resistant to the vaccines that are currently being used in India? And are they responsible for the surge of cases of COVID-19 in the country? With Sanjeev, this is Milan Sharma for India Today.
Which is why this is a good day to look at your frequently asked questions. We're going to have a doctors roundtable with some of the top doctors in the country. I'm joined by the country's leading doctor, Dr. Randeep Guleria, AIIMS director and also part of the government's COVID task force, Dr. Hemant Thakkar, leading physician from Mumbai, and Dr. Shahid Jamil, the country's leading virologist is joining me. Appreciate all of you joining us. Dr. Guleria, I must come to you first because the word which has troubled people in the last 24 hours is double mutant. What does it mean? Should we be scared, frightened about the fact that there could be a double mutant strain at the moment in the country?
I think there are two things there. One is that we all know mutations will occur, and sometimes mutations may occur at more than one site, or there may be mutations which may be occurring at different parts of the spike protein. So it's just a terminology in terms of the mutation that has occurred. The issue here are basically three or four. The first issue is this a mutant of concern? And that is what really needs to be looked at. Is this a variant which is of concern? In terms of three or four factors. One is it a cause of concern in terms of being more infectious? And does it have a higher chance of causing more cases? The second is it more lethal? Can it lead to more deaths? And that is another thing that we need to look at. And the third thing is, does it lead to more reinfection? That is the immunity that people had in the past from either the past infection or from the vaccine. Is there an immune escape mechanism? And this variant therefore escapes the antibody protection that we have, and therefore leads to emergence of newer cases of COVID-19. So these are the things that we need to look at it. But whenever we have a mutant which is of concern, we need to link that with epidemiological and clinical data. Because we know that this virus will continue to mutate, and you may have a large number of mutations which may be of scientific interest but may not be of clinical interest because they really are not changing the clinical profile of the disease.
So are you connecting the surge in cases to this new mutant, or is it too early to say that the double mutant is responsible for these reinfections or for the higher infection, sorry?
So it's too early to say because this can be multifactorial. This can be one factor, but I think we need good epidemiological data to link the increase in number of cases with the higher prevalence and spread of the mutants, either the UK mutant or the others, or this new double mutant in that area. It is also likely that this is also being driven by a lack of COVID appropriate behavior, which is also leading to a huge surge in various parts of the country because people seem to have gone into severe COVID fatigue and have sort of given up on all the lessons that we had learned over the last few months, and that's also sort of driving this new surge in the number of cases.
I just get in Dr. Jamil, because you are a virologist, Dr. Jamil, if you want to just take this question which has been raised, are any of these new variants more infectious? As Dr. Guleria is saying, difficult at this stage to say that these double mutants alone are responsible for the surge in cases, but could they be more infectious? Because we've got a lot of asymptomatic cases. Mumbai Municipal Commissioner tells me more than 80% of the cases in Mumbai are asymptomatic. What does that mean? Are these new variants more infectious, Dr. Jamil? Or less infectious?
There are two mutations that have come together in this one virus.
Yes.
But let me first say that two mutations coming together, there's too much being made out of it. People don't realize that the UK variant, which we talk about, that has 23 mutations. 8 of those mutations are in the spike protein itself. So here we're talking about two mutations in the spike protein. Yes, these mutations are key mutations in key residues of the spike protein. One is a mutation which is called L452R, which was first seen in California. And that was linked to a lot of cases when the caseload expanded in California. And it is suggested that that mutation allows the virus to bind more effectively to the receptor and therefore enter cells better. There is also evidence that that mutation evades neutralizing antibodies better than the non-mutation. And the second mutation, which is in this case E484Q, is slightly different from what is seen in the South African and Brazil variant, which is E484K. So these are two mutations that have come together. My information is that these mutations, this double mutation, has been seen at the rate of about 15 to 20% in the months of January, February, and March. So it's not that it is increasing, and therefore it's hard to say whether it is really linked to the surge that we have seen
sir,
in
net,
Maharashtra.
doctor, net, can I say it is not clear whether it is more infectious? Is that what you're telling our viewers, doctor?
Yes, at this point we don't know that. You have to, as Dr. Guleria was saying, you have to link it epidemiologically. So, for example, you have to see whether this mutant is occurring more frequently in people who have worse disease compared to those who have milder disease, or you have to link it to clusters where the virus has spread very quickly. Only then you are able to tell.
Okay.
At this point, we have the sequence information. What we don't have is the metadata of the samples that have been sequenced fully to understand this.
Okay, I have a reader query, Dr. Guleria, which you may want to take, and then I'll come to you, Dr. Thakkar, because IP Bajpai asked this, not getting this. Government says 711 of the 11,000 UK, South Africa, Brazil variants. Those are the cases that have been recorded by them. That's about 6%. What about the remaining 93%? What strain is that? Secondly, Punjab said 85% of their 400 cases are UK variant. Does that mean half of the UK variants are in Punjab? Thirdly, why hasn't the government put a number on India's double variant? How many cases? How many of the remaining 10,000 are India's double variants? Is there still very little information, sir? How many of these variants are the UK, South Africa, and indeed Brazil variants? And how many are double mutations, Dr. Guleria? Is this information not available at the moment?
So all the others that have been tested have been the traditional or the old variant, if I put it that way, and are not the new variants in terms of the South African variant, the Brazilian and the Japanese variant, or the UK variant. But this data is emerging. Remember, this is an ongoing process. The gene sequencing is being done on a regular basis. So we will get more data in the coming days in terms of how states are behaving, what is the prevalence of different mutants. And remember, this is something that we need to look at in a time sequence also. How has it evolved? If I go back to what happened in UK, in September, they really saw the UK variant and it was just causing a small number of cases and they did not feel it was of much concern. But by the time they reached December and they looked at the data again and they tried to link it with the epidemiological data, they found that wherever they were finding a surge in the number of cases in London and the southern part of UK, it was linked to the UK variant. So we need to see how things evolve over the next few weeks, and that will give us more clear picture in terms of both what is the link between the variant and the number of cases, and how is it evolving, and is it taking over from the old variant in becoming the dominant circulating strain. This is data which is going to evolve, and therefore we need to look at it in a sort of a time sequence manner also.
You put it well. So you're saying this is only the first stage. Let me come to you, Dr. Hemant Thakkar, because you're on the ground as a physician in Mumbai, which has the highest, Maharashtra having the highest number of cases, Mumbai also now over 5,000. Have you found in patients, many of whom are turning out to be asymptomatic, any signs at all of these new variants at all? Or is this purely on what you're seeing as a physician, a milder form of infection, nothing to be alarmed about at this stage?
No, I'd like to bring you from the laboratory bench to the hospital bedside. We definitely have a surge. We are in the middle of the wave, and there are no two things about it. Without wanting to sound alarmist, I think if you do what you did, you will get what you got. 2 weeks ago, we had mild asymptomatic numbers. A week ago, we had mildly symptomatic numbers. But in the last 2 days, especially in Mumbai, I'm afraid to confess, we're getting people with symptoms. We're getting people whose lungs are affected considerably. And we are pulling out from the refrigerators all the injections that we have stacked away. So there is something happening here. And what is happening has been clearly depicted by my colleagues, that this has always been a tug of war between the virus and the killers of the virus. And as we strangulated the virus tries to mutate, do everything to spread to become bolder and to escape that.
Right.
And we have exactly allowed the virus to escape. We've forgotten our masks. We've met in groups. We thought vaccines are here, so we have a liberty and a license. And lo behold, we are here with the large numbers. These numbers are allowing the virus to propagate. The transmissibility is stronger and faster, and the virus is making merry. When the virus has so many people to inoculate and to invade, the virus gets stronger. A mutation can be an upward mutation where the virus becomes stronger, or a downgraded mutation where the virus loses its virulence. But if the virus is victorious and it goes from patient to patient, it becomes stronger. And I'm afraid that's what we are seeing.
So you're giving us, you're telling us something which should worry us, that in the last few days you're seeing more and more cases of people getting active symptoms, and that's the worrying aspect, that therefore you, without being alarmist, these are troubling times. Let me therefore come immediately, and we'll take lots of questions because they're coming in. I'll come to Dr. Jamil and then Dr. Guleria on this question. I want both of you to respond. First, Dr. Jamil, will the existing vaccines work on the new variants? Lots of people are asking this. Covishield and Covaxin, will they work? You're a virologist, will they work on these new variants?
Well, data from other countries show that the E484K mutation is able to evade the antibody responses from vaccines partially, not fully. Whether that will happen here, we don't know that yet. And we really need to test this in the laboratory to find that out. I can't answer, and I would hate to speculate on this.
You don't want to speculate, Dr. Guleria. This is the question people are asking. Those who are getting vaccinated, taking the Covaxin, Covishield doses, how protected are they against the new variants, doctor?
So I think we need to have more data, but whatever data we have as of now does suggest that although the efficacy does come down to some extent, especially with the South African variant, it still gives us some degree of protection, especially against more severe disease. So the vaccines should be effective. How effective they are is something that we need to really have more data on, especially as far as the variants in India are concerned. And we need to really follow this up more closely over the next few weeks, because the virus will continue to mutate. And as we vaccinate more and more people, there will be pressure on the virus to really mutate further in terms of trying to escape the vaccine-related immunity that is there. And that is what needs to be closely monitored if we have to be ahead of the virus in terms of providing protection to our population.
Let me give you a follow-up to that, Dr. Guleria, because my correspondent Milan Sharma is asking this. Why is it that those who took the vaccine job, some of them are testing positive several days after their second dose? Have their samples been checked for mutations? Could it be that the virus is becoming resistant to the vaccine?
So this is an important question, and this is something that needs to be done. I think two databases need to be collected and gene sequencing needs to be done. One is of people who get infected 14 days after taking the vaccine. The sample needs to be evaluated to see what is is it with the variant or is it the old strain? And secondly, in those who have reinfection, those who have already had COVID-19 in the past and get reinfection, they also need to be evaluated more closely to see whether there is a new variant which is causing infection and the antibodies that they had in the past are not effective. But having said that, it's important to remember that even if you're vaccinated, you may get the infection, you may have the mild infection, you will not get a severe disease. The vaccine will protect you from getting severe disease, from hospitalization, from death. But how much does it prevent you from getting disease is something we don't know. You may have mild disease or you may be asymptomatic and you may still be infectious. So therefore, even after getting the vaccine, it's all the more important that we continue to have COVID appropriate behavior, continue to wear masks, because we may have a very mild COVID infection because we've been vaccinated, but we could spread it to others in our immediate neighborhood, our family members. And if they have not been vaccinated, we could give them a severe infection.
You know, a link to that, Dr. Thakkar, is the question which is being put, and again, as a physician, you could answer this. Why are the infections not down despite the vaccine drive? You know, these are average viewers asking this. They all want to get vaccinated, but are saying, why are the infections not down? India is in a strange spot at the moment. Numbers are rising of COVID cases, even as vaccinations continue also to increase. So what explains this, Dr. Thakkar? Is it lack of COVID appropriate behavior?
So where are the 2 weeks after 2 doses of vaccinations at all over? Just because you've had one shot doesn't mean you're protected. In fact, if you see sometimes the crowds of people that gather and that go out after their first shot of vaccination and celebrate, they go home and 7 days later they test for COVID positive. You have to allow 10 to 12 days after the second dose to get some protection. So don't tell me that there's so much vaccination and there's still so much COVID. We have only recently started and very few people, a minuscule proportion of the population has finished 2 doses. The answer is COVID inappropriate behavior. People with one shot want to celebrate and people with 2 shots have become negligent. So I think you have to wear the mask. Remember what Dr. Guleria rightly said. You will always get some degree of protection with the vaccine, so vaccinate. The protection will not prevent you necessarily from getting a reinfection, but that will be attenuated. You may not need hospitalization. You may not need major medication, but you still need to protect yourself. The Spanish flu lasted 2.5 years. I want to ask my Indian citizens, do you want to pull this on till 2022 or you want to quickly cage it? We had it nicely caged in December and January, and now you let the cage open. So I think we have to be very careful, COVID appropriate, and go ahead and take the vaccine.
Let me take this to you, Dr. Jamil. Why about the gap between the first and second dose? The government has gone from 28 days to suggesting 4 to 8 weeks. What's your view? Should patients who've taken the first dose now extend the period before they take the second, go well beyond 28 days? Is there an ideal period according to you, Dr. Jamil?
Well, this comes from a Lancet paper that came a few weeks back. As far as I'm concerned, it's a fairly sloppy study, and we should really not be basing our vaccination on this. The surge is now, it's important to get as many people get the second dose as quickly as possible. So I would still go with 4 weeks. And, you know, coming to your previous question, what percent of people have taken the vaccine? Less than 2% have been fully immunized, full 2% of India's population. So, you know, we've hardly given the vaccine to a small percentage of the population.
So should we be giving it to all? Should we be giving it to everyone now above the age of 20, just universalize?
No, not everyone, but look at the percentage. You know, you have in cities, you have seroprevalence reaching about 30 to 40%. Overall in India, maybe about 10 to 20%. So there are large numbers of people who are still susceptible to infection.
Right.
And as everyone seems to be agreeing to this, that, you know, it's not over yet.
No,
the way people are celebrating, the way people are gathering, it's.
But let me push you all
because of that.
Let me push you all, Dr. Guleria. You know, the question which is, you know, Dr. Devi Shetty, the cardiologist, wrote a piece suggesting it's time to actually take the vaccine to all above 20. To all those above the age of 20, just speeden up the process. Will that help, according to you, Dr. Guleria?
So in an ideal situation, one would like to vaccinate everyone if we could. But if we are looking at a population over the age of 20 and we want to vaccinate everyone, we are looking at close to about 90 to 100 crore people. And that means we will need almost 2 billion doses if we want to really vaccinate everyone over the age of 20. I don't think even if we were to get all the vaccines from every supplier in the world, we would have 2 billion doses. Therefore, we have to prioritize. And the aim of any vaccination program is to save lives to begin with. And that is why the high risk group need to be vaccinated first. Imagine a scenario where we started vaccinating everyone between the age of 20 to 30 and did not vaccinate people who are over the age of 60 to 60 years. And we had a huge death in that group. It would not be acceptable. So when we know that there is a high risk group which has a very high chance of dying because of COVID-19, we need to first vaccinate them to make sure that they don't die because of the disease, and then work our way down the priority list. This is what is done by WHO, by most countries. What we need to focus on, in my mind, is to really push the drive aggressively so that all those who are in the high risk group are vaccinated as early as possible, with more vaccination sites, with more sort of outreach, so that we are able to cover them quickly and move on to the next.
Sir, doctor, sorry to press you. Doctor, you're saying this even though you've admitted that there is no guarantee that a vaccination leads to immunity. Am I correct? So it's not just speeding up vaccinations, it's also ensuring that COVID-appropriate behavior continues.
Oh, yes. The two are not, you see, there's another thing that I would like to say. When we are looking at fighting this pandemic,
yes,
I think there are three or four things which need to move in parallel. They don't sort of work that you have one and you can do away with the other. And those 3-4 things are COVID-appropriate behavior, vaccination, avoiding crowded places, and the philosophy of testing, tracking, treating, and isolation. None of them can be put on hold or can come down if we really need to come out of the pandemic. So if we have a cluster of cases, we have to go back aggressively for testing, contact tracing, isolating, quarantining, and making sure that we don't miss out on any case which has come in contact with a positive case. Secondly, we need to avoid crowded places because they can be super spreading events.
So you're saying avoid crowded spaces, but we are in election time. You're seeing large gatherings. You've seen farmer protests. I met someone on the election trail in Mahabalipuram who said, and there were 5,000 people, sir, at the beach on that day. And they said, look, it's you, the rich people, who are worried about COVID. We want our jobs. They said, we will not, we are very happy where we are. How do you respond to those who are saying, look, if the politicians are addressing large rallies, why are you telling us, the people, for example, to avoid crowded places?
So I agree. We need to really understand that any crowded activity can be a super spreading event. It could be a rally, it could be the Kumbh Mela, it could be any other activity. We need to develop a strategy that we minimize the chance of infection happening in those areas, and therefore adequate steps need to be taken. If we don't do that, any of them can lead to a huge surge in the number of cases, and that also is reflected in the crowds that we see in cities. You have to just go to the marketplace and you'll see that there's a huge crowd and hardly anyone is wearing a mask.
Right.
They're not at all bothered about COVID-appropriate behavior. So we really need to work aggressively on a behavioral change which needs to happen in our population. And otherwise, we will not be able to contain the spread of this virus because a large majority of our population is still susceptible. They don't have antibodies to protect themselves.
Right.
And the virus will just run through the population, causing a huge number of cases.
You know, the reason, and I would take this to you, Dr. Thakkar, because we've got Holi coming up in a few days. Someone is asking, what are the precautions to be taken during Holi celebrations? I know Mumbai and Delhi have already said no Holi in public places. Now, there is COVID fatigue and there are the celebrations. What would you therefore advise people? Should they not go out and celebrate? I come back to it. If politicians are holding election rallies with large number of people, no one wearing masks, why should people not celebrate Holi?
So I would strongly say don't celebrate Holi. Holi is going to come again year after next and next year. Don't celebrate Holi because Holi is a festival where you meet people, you gather, you are in proximity, there is promiscuity, and that's going to spread the virus. You know, to put it lightly, since we are in a festive mood, the scourge is the surge. And if we are on the verge of the pandemic again showing its face, we have to purge the indiscipline. So all this has to be looked into regarding the other rallies and the gatherings. It's up to the government.
So we've got a Kumbh Mela, coming up. We've got a Holi. Are you saying just stop all celebrations?
Well, I would say for the moment, stick to your celebrations behind closed doors. If you have to celebrate, you can celebrate in smaller numbers. But if these numbers, which are now almost the tip of the iceberg, keep snowballing, we're going to be back to same time, same show last year. And that's really scary because on the ground, in the hospitals, we are facing the slack and we are facing a lot of problems in the hospitals and in the clinics.
Right.
And we don't want to go through that again because it is preventable.
You know, the next question, Dr. Guleria, localized lockdowns, is that the new normal? You know, in Maharashtra, sir, Nagpur has emerged as a cluster where a significant amount of samples of a double mutant variant have been found. There's a lockdown in Nagpur. Do you believe that localized lockdowns this time? Or do you see the possibility of another lockdown as some are fearing?
So I
A
think
nationwide lockdown.
what we need to do is at this point in time, go back to the basics of what I had mentioned: testing, tracking, treating, isolating. A very aggressive surveillance is needed so that you pick up areas where clusters are developing. Those clusters should become containment zones. You could say that we really make aggressive containment in that area so that everyone in that area is tested, they are treated, they're isolated, and they are not allowed to go out, so that the cases from that area don't spill over to other areas. If you say does that mean that that area has a lockdown? Well, it could mean that, but then we really need to contain the infection in areas where it is, because remember, there's large part of the countries where we don't have the infection. So if we are able to have some containment zones where we don't allow the infection to spread to other areas, we may still be able to really keep the cases down and then aggressively move on the vaccination front. But we need to have a comprehensive strategy in terms of preventing the rise in number of cases, looking at the strategy that we've actually adopted over the last 1 year.
So a localized lockdown seems to be the way forward. Again, people are asking this question, and this comes, and any of you could take this. Is a 6 weeks gap or a 8 weeks gap better? A lot of people vaccinating, again asking this question, especially with Covishield. Dr. Jamil, you said too early. You said there's no difference between 28 days and 56 days. Am I correct, Dr. Jamil?
I said that I advocate going for the second dose after 4 weeks.
You're saying after 4 weeks. Dr. Thakkar, how many weeks are you telling your patients?
I agree with Dr. Jamil. I took it after 28 days, and the sooner you can complete your second dose, the faster it is to get immunity. This was actually innovated by UK when they fell short of doses.
Right.
So I don't know whether the science and the politics works, but I know that 2 doses definitely work. So let's give it to them and let's get it as soon as we can.
Okay, Dr. Guleria, you have to leave for our sister channel, Aaj Tak. They're also very keen to hear your views, but I just want to know from you one question, because you're involved with the government. How different is the government strategy going to be, sir, for this second wave, if I may call it, compared to the first? What are the biggest lessons that India has learned in the last 1 year?
So I think the last 1 year has been really a learning lesson for India in terms of multiple factors. When it comes to hospital care, our treatment strategy has become much better. We've got COVID hospitals, COVID ICUs. We know that there is how we can have home isolation, which patients we should admit, and what are the drugs which work, which was not there a year ago. We were experimenting with a lot of drugs like hydroxychloroquine and other drugs. Now we have a better picture.
Okay.
But having said that, it's been the longest year as far as healthcare workers are concerned. The last 1 year has been really backbreaking for them. And there is a lot of fatigue that we have as far as healthcare workers are concerned. And therefore, we really need to work to energize them, get them back, and really get the system in place, because this surge is going to subsequently lead to more and more hospital admissions and a huge challenge as far as the inpatient care is concerned.
Right.
So we really need to work aggressively in trying to prevent the cases from developing rather than having to really manage the surge in a hospital setting. So I think we should go back to prevent the increase in number of cases rather than working on managing cases in the hospital.
Okay, Dr. Guleria, you're going to leave us for Aaj Tak, but Dr. Thakkar and Dr. Jamil, you're still with us. Thank you very much, Dr. Guleria. Always a pleasure talking to you. You give our viewers a lot of information. Dr. Thakkar, why don't you take this? Because when Ruchira Banerjee wants to know, when should a COVID recovered person take the vaccine? Interesting question. When should a COVID recovered person take the vaccine, Dr. Thakkar?
So we usually advise our COVID recovered patients to wait for 8 to 10 weeks. And after 8 to 10 weeks, they could do an antibody study. But even if they didn't want to do that, if they took the vaccine after 10 weeks, they would be fine. And this is the norm that we've been practicing.
You can also take this, Dr. Thakkar. What is the effect of the vaccine on those aged 90? Asked Satyendra Nath Sinha. I mean, are you finding, as some are saying, that younger patients are more susceptible at the moment than the older?
Well, you asked two questions. What is the effect of the vaccine on people over 90?
Yes.
The immune system of elderly patients is a little weaker. So obviously vaccines after the age of 75 produce a minor or an attenuated response, but they do help. Now, for the younger people, if you vaccinate the younger ones, their immunological system being stronger, they will produce more antibodies. So government now from the 1st of April has said anybody over 45 is okay.
Right.
I'm soon hoping that the government allows anybody over 21, which is not too far away, and we'll get there.
Couple of more questions for our physicians. Physicians often get asked questions in these matters. Harshit Kumar says, there was a little blood when my father got vaccinated yesterday. Is that normal or something to be worried about, doctor?
Not to be worried. If it's a prick, you'll get blood. Don't worry.
Atul Lal says, is it safe to take the influenza vaccine after 2 weeks of the first COVID dose?
Yes, affirmative. After 2 weeks, you can.
Munish Duggal, doctor says, is continuous pain in the eyes and headache 4 days after the first dose of Covishield a vaccine side effect?
You could construe it as that. You should not worry. Take symptomatic treatment. If it doesn't alleviate, go and see the doctor.
My final question is in a way to you, Dr. Jamil, because you're the virologist. Should India be getting more vaccine options? Should we be universalizing the vaccine? Are we still too slow, Dr. Jamil, with the vaccination drive?
So the way I see it, it's a supply problem right now. If you look at the data on the CoWIN dashboard, you'll realize that so far 90% of the vaccine shots that have been given are Covishield. Only less than 10% is Covaxin. And Covishield, from whatever we read in the press, has run into some supply issues. I think the time is right for 3 other vaccines whose efficacy has already been established, that have been approved in other countries, that have partnerships with Indian companies to be approved for emergency use in India. And these vaccines are the Russian Sputnik vaccine, these are the Johnson & Johnson vaccine, and the Novavax vaccine. All of them have turned out to be very good vaccines.
So you're saying have more vaccine options.
We need to increase our capacity.
You're saying have more vaccines options to increase capacity. Interesting.
Have more vaccine options, yes.
More vaccine options.
The regulator is waiting for bridging trials.
Right.
But I would let everyone remember that Covaxin was approved without any efficacy data. Covishield was approved without any bridging trials.
Right.
So why are we waiting and not approving more vaccines when it's needed?
You make a very fair point. Sir, Dr. Thakkar, an interesting question. Should one have a blood test before the second vaccine?
Not required. Don't waste your blood or your money.
Don't waste your blood or your money. Someone wants to know, can I have alcohol between my first and second dose of the vaccine? All kinds of questions, doctor.
If you must, you can. But if you don't, you're better off. But that doesn't mean you can't.
Net, I think both of you are suggesting don't get alarmist, but at the same time, don't get complacent. What has happened, I think, in the last few weeks is we've got complacent at one level. The vaccination drive hasn't picked up as fast as we hoped. And the double mutant variants and possibly other variants have also entered, and that are causing fresh causes of concern. COVID-appropriate behavior is needed. And as doctor is suggesting, avoid Holi. Doctor, Dr. Thakkar, you're going to have a lot of people saying there, you are playing spoil sport. You're not letting us celebrate Holi. You don't want the Kumbh Mela, but election rallies can continue. I keep asking that. If politicians can have their rallies, why can't people have their Holi celebrations? One last time, Dr. Thakkar. Give me an answer for that.
I'm saying nobody should conglomerate in groups, whether they are film stars, cricketers, politicians, or social animals. So each one to himself and God for all. The COVID virus levels everybody.
And I just want to know, Dr. Jamil, to you, because let's get this one clarification right, one last time. Are the new variants deadlier than the earlier one? Do you want to make a clear...
We don't have data for that.
You don't have data. So you're saying it would be unfair at this stage to suggest one is more deadlier than the other. Okay, I think we've more or less answered lots of our viewer questions. I once again appreciate all my doctors joining us. In the last 1 year, this has perhaps been the best part of doing news anchoring, learning so much about the world of medicine from all you experts out there. You are really, in a sense, been our warriors, our corona warriors. So thank you very much to all our doctors for joining us on this roundtable. Dr. Jamil, Dr. Thakkar, and earlier Dr. Guleria. Much better talking to doctors than I say party spokesperson. Hope you agree. Let's take a break. When we return, we'll just give you all the very latest on the election trail. We'll be on with our ground report from a remote village in West Bengal, Jhargram district. We'll tell you more on the news today. As always, news without the noise.